silent pandemic. That's how antimicrobial resistance, AMR, is increasingly being described. The full scale of the threat is often underestimated, despite the rising global death toll from drug-resistant infections. In this episode of In the Know, the Most Honorable Dr. Corey Forde, Director of Clinical and Diagnostic Services at the Queen Elizabeth Hospital, provides an in-depth explanation of AMR. He highlights the growing concern of sexually transmitted infections becoming resistant to treatment and emphasizes the urgent need for more responsible antibiotic use by both doctors and patients. I'm Krystal Hoyte, and this is In the Know. Dr. Forde, thank you for joining us.
It's a real pleasure to be here to discuss one of the most pressing global issues at this particular point.
Perhaps we can start with what is antimicrobial resistance and the challenges that Barbados is currently facing as it relates to AMR.
So antimicrobial resistance sounds, for most persons, when they listen to some word, big word, for which people sometimes are not connected with. But it's simple. When you have an infection out there, whether it be a bacteria, a virus, a fungi, or even a parasite, sometimes the doctor opts to put you on treatment. And that particular treatment is called antimicrobial. And I use the word antimicrobial here because antibiotics specifically speak to bacteria in essence. And they're antivirals, which will go against the viruses, the antiparasitics, which will go against the parasites, and the antifungals, which will go against the fungi infections. And that's important to understand. So when we speak about antibiotics, we're talking about the effect against bacteria. So in general, if one thinks about it, when you get an infection or anyone gets an infection, the doctor tries to put you on one of these. When it doesn't respond in the way it's supposed to, normally, then we can consider that particular bug, whether it be the bacteria, a virus, a fungi, consider that to be some form of antimicrobial resistance. And that's something that's generally found exactly where I'm sitting today in the QAH laboratory. In essence, antimicrobial resistance is a global problem, not only in terms of humans, and I just spoke in terms of humans, but in terms of animals, in terms of the impact that it can have in the environment, and the impact it can even have in terms of food-related issues, and the transmission of that from food to humans, or from the environment to humans, and the sort of catastrophe it is. I will go as far as to say that this is being recognized now as a global problem since it was first tabled at the United Nations in 2016. And countries across the globe were asked to really go back to their particular countries and develop national action plans against antimicrobial resistance. And certainly Barbados was one of the first in the Americas to come up with that particular plan back in 2016. But interestingly enough, Barbados really partnered with Malta earlier, I think in September, October, at the United Nations to really table a declaration which was passed at the United Nations at the 79th United Nations. I'll go as far as to say if we do nothing globally in terms of antimicrobial resistance, by 2050, it is expected that this will become the most common cause of death, far exceeding cardiovascular disease, NCD-related issues. If we do nothing, there's where we end. And that declaration in itself, I think the Irish Barbadian needs to understand the importance of that. Why are we concerned? Why is this event a general plan for the Irish Barbadians sitting in their house today? Many moons ago, antibiotics were found, and they would have acted against bugs. Now we're seeing the same antibiotics that were used in the 1950s being no longer effective as they would have been previously. And this is a major, major issue. It means that there are people across the globe who are coming with infections, and the doctors will struggle to find the right antibiotics against them. What's really going on here in Barbados? I will tell you, in 2015, Barbados recorded one of the most scariest bugs at the time in country. And I remember that quite well because that was my return as an infectious disease doctor from Canada. And that bug was carbapenem resistant Klebsiella pneumonia. Now, it sounds like a mouthful, but it's a very, very important bug to understand. Carbapenems, as an antibiotic, which I'm sure most Barbadians will never have to have used or never have, contact with at all, or probably have never even heard. That's really was one of the last line antibiotics at that time. And I think we need to understand that. So from then to now, we've seen changes in resistant profiles. Resistant meaning that the bugs are no longer able to respond to those particular antibiotics. And now we're recording that resistance in Barbados. I think at the time, for most persons, they understood that this was something you mainly see in hospitals where you have a lot of antibiotic use. But I will tell you, in the last couple of years, the last 3-4 years or so, we are now seeing those bugs coming from the community. So the hard work that the guys do here in the laboratory and identifying these bugs is not only now from our hospital patients, but we're seeing those come through the doors of our emergency department, which really sets up a tone for me for us to understand what is going on in our community in terms of antibiotic use. What are people doing? Where are we using antibiotics that we shouldn't be using? My concern, in essence, for the average Barbadian is to understand a few vital facts. And one of those vital facts is simply this, that every time you have an infection does not equal a need for an antibiotic. So how could people be using them within the community in the way that they're not supposed to use them? I think way one is, you get an infection and you have a pharmacist friend and you go to the pharmacy and say, listen, I want a 500. Classically, I heard the Barbadians say they want a 500. They want a 500 or they want one of the other oral antibiotics that they can get from the pharmacist. And because it may be your friend, they give you some antibiotics or they give them over the counter. That is something I want people to stop doing. So it's one of the things I want to talk to pharmacists. Point number one. Point number two is within the medical fraternity as well, we understand that there are needs for antibiotics and there are needs for antivirals and there are needs for antiparasitics. What I want people to do is to really reconsider that they use within their own practice out there within the community to really use these particular drugs attached to particular infections. And then point number three is for the public to understand that if they don't take their antibiotics like they're supposed to, either they stop and start or they take them up to a particular time and then stop, right? And then save the rest for later if they get an infection, that it does not work like that in the real world, to complete their course of antibiotics. And I think that certainly is very important. And then for the last part, to also encourage other facilities out there who may be the clinics or the hospitals, etc., to look at how they're using these antibiotics within their facilities. And there are systems and ways that we as infectious disease doctors do that try to advise hospitals as to how to use those particular items.
I want to jump in there. Are antibiotics currently being regulated in Barbados? And do you feel that stronger measures are needed to control their use?
Well, I think that is an interesting question. From the context of, I believe that this is not only for Barbados, but globally there needs to be regulations of use of antibiotics. And yes, we have a good idea of what antibiotics come into the country. The ministry obviously has been working on the amount of usage patterns within country. But in talking now about a private level and in the private stream, because they're now seeing these bugs, which I never saw coming from the community coming in, we need to do a balance check of how they're being used within those settings. It needs to be that surveillance system, which used to be very robust, coming in from the private sector to the Ministry of Health, to see what is there, to see the bugs which are there, to see how we can take care of them. I will shiver to tell you on this particular program that we've recorded bugs in more recent times which are not sensitive to many of the antibiotics that we have in country. I think in a few cases we had to really seek out and fly in some of these agents. And it comes with a cost. It comes with a cost. And if we as a country don't do something about this, and if we as a global Caribbean platform and a global platform don't take this as serious then we're going to have people come in with infections who will normally come in and be treated easily, and we will have, nothing on the ground to treat these particular individuals with. So the law needs to play a part in this as well. And especially because I just really need to say this, that the use of antibiotics is not only in humans, but also in animals. And that particular part is important. And how they're using animals, I was like, why would they use it when the animal is sick? Yeah, but dating back to the 1950s, people were using antibiotics as growth promoters, to try to get the biggest chickens, to try to get the biggest pigs, so they get better pork. It comes with more money in terms of that industry. So we need to look at that as well, and that sometimes require legislative activity to try to do it. I know there's been a lot of work, certainly by the national AMR team, to really promote that, and to promote it not only for human health, but promote what we call a One Health approach. So looking at the whole idea of antibiotic use in animals, in humans, its impact on the environment, and the antibiotic use in agriculture as well. For the average Barbadian, one of the things they need to do as well, if you have antibiotics at home, and don't dispose them down your toilet. That sounds like the easiest place. Don't throw them out into the environment, because the same way how they impact humans and animals, they impact your environment as well. It can impact even as far as, say, crop growth, and also affect the ability of having, crop food, your interaction with the environment. So they will kill all the bugs in the environment they can kill, and the only ones that are left behind were the ones that they can't kill. Imagine you're having that type of effect now on crops, that you had fungi which are affecting crops, or you have bacteria in rare cases where we affected some of the crops out there. What actually will happen is they can cause early deaths of those crops or a lack of productivity. So it's something to need to think about as well. And if I may, if you give the opportunity to, this whole idea of antimicrobial resistance is nothing new. It's not since COVID. It's way before it, dated back into the past, the 1940s, 1950s, probably even further than that. And I think one of the things that brought the whole idea of antimicrobial resistance to the sphere, and really up there, was really dates back in my mind, in terms of infectious disease, up to the 1950s, the late 1950s in the USA. When there was a lot of antibiotic use as growth promoters. And after you get to the farm, and then you dip it in some antibiotic type water, and then put it out there, and there were the nice big pieces of chicken which people were quite happy with. And I remember distinctly in training and that discussion, and what was important about that, there was an outbreak of a very bad bug, which some Barbadians might have heard of and some might not, but it can be very dangerous, which is called MRSA, or methicillin-resistant Staphylococcus aureus. And why is methicillin-resistant Staphylococcus aureus, was it a problem back then? Is that many of the workers who were working in the production line developed skin infections. And they traced it all back to the beginning. And this is the point. When you use an antibiotic, it doesn't only kill the bug that you're targeting, it kills everything it can kill. And the only thing it can't kill is the things it can't, which are the things that will be left behind. And they then might become part of what we call, in my world, your normal flora, your normal part of your normal biome, as we will call it. And they just stick there. So for some people, this talking about it, it seems they feel far removed from it. But I just want the average Barbadian to picture an environment where you come in with a infected toe because you had a stump toe, and you come in infected toe and you have no antibiotics on earth to treat. And that is the stark reality of where we're headed. It's often referred to in our world as the silent pandemic. There are many deaths by minutes, 6 minutes or so. There are many deaths that occur because of this. And I want people to understand, if we don't take action now, by 2050, which is not that far away, this will become the most common cause of death. And this is why the global platform at the UN, at that 79th UN gathering, came together and unanimously agreed that this was one of the world's greatest threats for the future. Just think, a simple cut on your hand that's infected, and we have nothing to treat you with. That is where we might end up in the very near future. But to say that we already have bugs on the ground like that, lucky for us, Barbados is a very resilient country, so we were able to get some of these drugs, but they come at an expense. And as I said before, it would also come from the perspective of a large economic impact in terms of getting these drugs. And the other part of this, which I think needs not to be forgotten, and it's really something that kind of bugs me, is availability. So while some of the other countries may have easy availability to these drugs, for some of the other countries across the globe, and especially the global south, which is going to be really the area of the globe which is going to be majorly impacted, the access to some of these drugs is not actively there. We'll be able to get some of these drugs on the ground in our platform, but they're not used. And to be honest with you, one of the other challenges with this whole idea of antimicrobial resistance, I wouldn't call it bug resistance or germ resistance, so everybody understand, is it germs that's the problem. The other bigger issue is not only access, but the fact that there are some people out there who have access to them and you can get appropriate treatment with them, but then for some countries, they're not even able to identify the bug. And that, across the globe is also a challenge. But I think also coming out of the whole idea of antimicrobial resistance, and I think Barbados needs to be proud of its infection prevention control platform. Because if I go back, I tell you, I've asked the average Barbadians how, even if you never come to the hospital and you have it in the community, how you got it. It's usually by these. And that's where infection prevention control has done a tremendous job within our own system, both in the hospital, and there's a robust training recently in the polyclinic sector, and we do have people passing through our own department to do with that. You can't, the easiest way to spread bugs are with these fingers, 10 fingers for most of us that God has given us. And I think that when we recognize that and the parts of simple things such as hand washing, as well known during COVID, and people did that religiously during COVID, I think we really need to go back to that as well. And in that declaration, it was part of that declaration involved the whole idea of countries all having infection prevention control programs, but also putting the money where their mouth is, funding those antimicrobial resistant plans which countries have, but also funding the programs on the ground to make it happen. And also the whole idea of sanitation, water availability, and to try to stop spread of infections within the country and within their own hospitals. So I think that's where we're at globally. We just have to put our money now where our mouths are.
When we return, we're talking about antimicrobial resistance as it relates to STIs. Stay with us. Dr. Forde, when we speak about AMR, we often don't talk about STIs. But there's been a number of studies done by the World Health Organization where they share that there is a widespread resistance to most medicines used to treat STIs, specifically gonorrhea. And so I have to ask, how is antimicrobial resistance impacting the treatment of sexually transmitted infections here in Barbados?
Well, I'm probably going to speak more for the global platform, but I also mention a few keys for Barbados. So we talk about sexually transmitted infections. It's often one that's a very ticklish area to talk about. But like I said before, resistance does not only include bacteria, things like gonorrhea, for example. It also includes things like viruses. So there may be as well resistance to HIV, and there is known resistance to HIV. People don't respond in the way that you would expect them to respond sometimes. And then in terms of gonorrhea, which people, because it's something that's treatable, people don't spend a lot of time thinking. There's a lot of information out there in that. If you look back in the 1920s, 1930s, 1940s, 2000s, you will see a trend in terms of things like gonorrhea. There's greater resistance, and it's something that we've seen certainly here within Barbados as well. So for sexually transmitted disease, we'll follow the same tune. In fact, I'll go as far as to say that some countries are now recording resistance against drugs such as scaring anybody with the cephalosporins. And once you get to that point, then you're going to be really, really struggling. I know some countries in Asia have recorded what we call extreme drug resistance gonococcal infections, for which basically the treatment is difficult. And just imagine that present here in Barbados. And I say that from the context that Barbadians travel and go all across the globe. And they can interact in ways they probably shouldn't, and they obviously can bring those things back home. And those are things that we will certainly have to deal with in countries. The globe now is one global sphere. So when you find resistance in parts of the world, whether it's like, for example, Southeast Asia or Europe, sometimes you see those bugs traveling and coming down certainly into the Caribbean. Is something that we have our eyes open for. The Ministry of Health has a very good surveillance system in checking these, and a reporting system even from the private laboratories. When they find bugs, they report it into our system as part of a surveillance program to be able to capture that as well. But I think the truth is, when they talk about antimicrobial resistance, the average Barbadian might say, well, Dr. Forde, so why they don't just make more antibiotics? So they don't come with more novel antibiotics? And they have, but as fast as they find them, the bugs are smart. I mean, they're smaller than us, but they're quite smart. And resistance sometimes develops. But a little bit more than that, it is not totally economically viable for companies. This is one of the pushes as well. It's not economically viable sometimes for companies to go on, a platform to try to find new antibiotics. Why? It's not like giving somebody Crestor, or people know that, or Lipitor, or a heart-based drug which we have to take for the whole of their life, which they continue to get economic benefits from. If you're going to find a new antibiotic that's novel and it's now able to act against a bug, and the platform of those bugs is not great, then you're not going to be making a lot of money. So for them, the manufacture or research into that is not economically viable for them. And the word platform, including that declaration, there's encouragement to that and economic benefits that I think that we need to look to see how we can expand in that particular area. So for me, that's a challenge, availability, but also the fact that many companies are not able to do that. And I think that's one of the areas that they're looking at to see how they can encourage companies to invest in research towards the betterment in that area of availability.
And on that note, we'll take a break here. Dr. Forde, tell me about some of the work you and your team are doing as it relates to antimicrobial resistance.
So we're doing a lot of work in the ground. I'll just educate you to that. So a lot of the work forms part of what we call antimicrobial stewardship on the ground, and having an antimicrobial stewardship team to look at the amount of antibiotics. The ground is a big team of the pharmacists, those in the laboratory, microbiologists, and doctors and nurses, and we round in some of the most pressing patients or antibiotics or need for antibiotics and give the appropriate advice. But I want to say that even before we get there, we first have to identify the bugs to decide what to put them on. And the very sick today is one of the most significant areas, I think, in the institution, in the microbiology lab. And I just want to commend nationally the staff within the microbiology department who work exceedingly hard. They're the stars behind the processes for us as doctors and nurses, and I think they need to be commended for that. The work that they do here is important for the average treatment of infections, identifying particular bugs. And I just want to take the opportunity to show you, this is one of those bugs which is called MRSA. Don't be afraid. It's well protected, and we know that it is that because we have these antibiotic discs on the plate. And if you look carefully, what you will see is there's nothing around here, there's nothing around here, there's nothing around here. But around here, there's just a small lining. And this is the antibiotic that is supposed to react very well against, which I expect all about here to have a large chloride, and it doesn't. So that tells me that this bug is resistant to every single thing predominantly on this plate, and with the exception of this one. And I have one that is even more striking. So normally, there's something called, I talked to you before when we had the outbreak several years ago. And this bug that is on this plate is called Klebsiella pneumonia, right? And you see, if you look, there's a clearing around all of these different antibiotic discs. Once you have this clearing, it means that the bug can't grow out properly because the antibiotic is inhibiting its growth, like how it would do it in your body. Now I'm going to show you another plate. And look now, this is another bug, which is called the same Klebsiella, but a resistant one. You can see around these circles, it's doing nothing. The bug is just growing past it. And that's scary. And even for the one here, which is the last line antibiotic that we have in country, there's a good example, which is called meropenem or carbapenem or imipenem. You recognize there's a clearing. But if you look carefully, you can see little dots in between, which means it's growing past it, which means none of these antibiotics, the most powerful antibiotics, are on this plate, and it's struggling. This is where we're at. This is the reality of where we're at in country. And this is why all the things I've mentioned before, we need to act so that we don't have a case where there's not even a clearing on the plate. But this one is one of the most serious ones that I hold today in my hand. And who's responsible for getting this information? All the beautiful men and women who work in this laboratory, who push that information out to help save the lives of Irish Barbadians who are passing in and out of this hospital. And I applaud them for their efforts. I applaud my team for their efforts in terms of pharmacy and the new antimicrobial stewardship pharmacists. I applaud the infection control team who worked tirelessly throughout the institution to try to prevent that. Now I need, because we're having a challenge coming for the community, I now need people in the community to take heed with regards to this particular issue and look at all the things which I've spoken about today, and not only look at them, but to act. I also need those private institutions out there to look to see that you implement infection prevention control programs within your hospitals. The emergency facilities outside to do the same, to look at how they're treating people, to look at how they're giving antibiotics out. And also now need to look at the national level, not to only look at humans, but to look at the impact on animals and to look at antibiotic use and do more research in terms of what's going on in the environment. I know a lot of that has been done and a lot of it is currently on the way. I think if we do this as a nation, that we can reverse this. We have proven it already when we had that outbreak in 2014, 2013. We proved that we reversed the trend for a short time within hospital, but now we're seeing the issues now coming from the community. It is scary, but it's reality, and this is where we need to go to.
A timely and necessary conversation. Dr. Forde, thank you for making me time.
Absolute pleasure.
And thank you for joining us.